Hello, welcome back. Today we are looking at communicable diseases involving fecal contamination, water, food, and other vehicles of transmission. Okay, so we are going to talk about poliomyelitis, dysentery, amoebiasis, and cholera as well as typhoid. So this is what we're going to talk about. Okay, so poliomyelitis is an infectious viral disease that affects the central nervous system and can cause temporary or permanent paralysis, also known as poliovirus. So what is commonly referred to as polio is as well known as poliomyelitis. It's actually the same thing. So the poliovirus is an enterovirus from the family known as Piconaviridae. Okay, that is the family from which it belongs, and there are three serotypes of this disease, which is type 1, 2, and 3. Therefore, immunity to one serotype does not guarantee immunity to other serotypes, meaning if you are immune to type 1, it does not guarantee that you are also immune to type 2 and 3. Therefore, this virus can rapidly be inactivated by heat, formaldehyde, chlorine, or ultraviolet. So the use of this can actually be used to deactivate the poliovirus. Poliomyelitis pathogenesis, it usually uses enters the body through the mouth, and replication is done in the oropharynx and the GIT. It invades the local lymphoid tissue and may enter the bloodstream, okay? And then infect cells of the central nervous system. So it goes all the way up to the central nervous system where it causes destruction of the neurons, resulting in distinctive paralysis, which we have noticed in conditions that have to do with polio. Okay, so its incubation period is somewhere around 3 to 6 days for non-paralytic polio, and 7 to 21 days for onset of paralysis in paralytic poliomyelitis. Paralysis caused by polio is often permanent. So it is divided into it can be classified in at least 3 types, which are number 1, paralytic disease, abortive poliomyelitis, and non-paralytic. So in paralytic disease, it may be caused by wild-type polioviruses, attenuated polioviruses in oral vaccines, or by vaccine-derived polioviruses. So the same oral vaccines that we administer, if administered on a lowered immunity, or if there is anything wrong in it, it can actually cause active poliovirus, which is paralytic in nature most of the times. Abortive poliovirus is the mildest form of polio, and non-paralytic poliomyelitis symptoms are more severe than abortive poliomyelitis, but not as bad as paralytic. In that, in non-paralytic and in abortive poliomyelitis, the poliovirus neither entered the central nervous system nor damaged the neurons. Okay, it is non-paralytic, so it just has the symptoms, but it has not entered the central. It has not affected the neurons, so it is non-paralytic. That is what is characterized in non-paralytic and in abortive poliomyelitis, whereby in paralytic poliomyelitis, the most severe, it is actually the most severe, and may result in permanent paralysis of certain muscle groups, including breathing muscles and leg muscles. So this one usually cripples the person that it has affected. The reservoir for poliovirus are humans, and transmission is through the fecal oral route, or oral to oral route. It has a temporal pattern of spread in which it peaks in the summer during the time in temperate climates. It peaks during summer in temperate climates, and no season pattern in tropical climates. Communicability Communicability is that it is highly infectious in days before and after the onset of the symptoms, but poliovirus may remain present in stool for up to 6 weeks. So meaning it can spread from the infected stool for a period of up to 6 weeks. Okay. It has it is really a public health concern. Okay, in that it is communicable, so it is a public health concern. Okay, it mainly affects children under 5 years of age, and 1 in 200 infections lead to irreversible paralysis. Among those paralyzed, 5 to 10% die when their breathing muscles become immobilized. Cases due to wild polioviruses have decreased by over 99% since 1988, from an estimated of 350,000 cases in more than 125 endemic countries to just 2 endemic countries as of October 2023. So this actually what we have heard from the public health point of view is that polio in some countries has been eradicated. Actually, even in Zambia, it was declared that it has been like eradicated. Okay, so we we can safely say now from the United Nations point of view, from the World Health Organization's point of view, can safely say at least 99% of cases have been contained. Only fewer pockets of polio have been resurfacing from one country to the other. Okay? As long as a single child remains infected, children in all countries are at risk of contracting polio. Therefore, efforts have to be put together, global efforts have to be expanded so that these infections are tackled by building effective surveillance and immunizations. We talked about these effective surveillance and immunizations in the previous topic, meaning if one country is led to grapple with this infection, it would be risk also to the other country, and at the end of the day, the whole globe can be spread with this infection. Therefore, the WHO emphasizes that all member countries heighten the surveillance, and all countries actually heighten the surveillance so that it is kept from its point of identification. In treatment, there is actually no treatment for polio and can only be prevented. Polio vaccine is given multiple times and can protect the child for life. We hear that it is usually happens or prone in children below the age of 5. So if vaccinated well, it can protect the child actually for life. The two types of vaccines that exist are oral polio vaccine and the inactivated polio vaccine. So it is through vaccination that it can be prevented, and treatment is actually not there. Okay, so that is about polio. That is about poliovirus and how it affects the globe and how we can manage it. The next one is dysentery. Dysentery is defined as a diarrhea with visible blood in stool. Okay, so dysentery. Okay, so we are saying dysentery is defined as diarrhea with visible blood in stools. Okay, the most important and most frequent cause of acute dysentery is Shigella, especially Shigella flexneri and Shigella S dysentery, which is type 1. Okay, dysentery is an important cause of morbidity, mortality associated with okay, associated with diarrhea. About 15%, about 15% of all diarrhea episodes in children under 5 years are dysenteric, but these cause up to 25% of diarrhea deaths. Okay, it is severely, it is especially severe in infants and children who are undernourished. So being undernourished is one of the factors that make it actually to the condition to worsen. Develop clinically evident dehydration during their children that develop clinically evident dehydration during their illness, or are not those that are not breastfed. It usually comes out to be very severe. Okay, it has a more harmful effect on nutritional status than acute watery diarrhea. So the clinical diagnosis of dysentery is based solely on the presence of visible blood in diarrhea stool, which can be analyzed and identified during diagnosis using diagnostic tools in the lab, such as the microscope. So the microscope, using the microscope, this can be seen. Okay. From outside, we can see watery diarrhea, which is sometimes severe and it may cause dehydration, as well as visible blood stains in this diarrhea. If not well controlled, it may lead to death, okay, which is usually caused by extensive damage to the ileum, colon, as well as complications of sepsis, secondary infection, such as pneumonia or severe undernourishment, can actually lead to death if it is compounded with this condition. Okay, children with dysentery should be presumed to have shigellosis and treated accordingly, because shigellosis causes about 60% of these dysentery causes seen in health facilities. And nearly all cases of this caused by Shigella are severe and life-threatening. Therefore, there are 4 key components of treatment for dysentery, which are then number 1, antibiotics should be administered and taken accordingly. Fluids should be also administered in a bid to rehydrate the individual. Feeding is very important because it minimizes the worsening. Okay, it minimizes the worsening or the severity of the effects of this condition on the patient. Follow-up is very important so that medication and all the other 3 are done accordingly. Okay, prevention is key. And since the microorganism that cause dysentery are spread by fecal contaminated hands, food as well as water, the spread of shigellosis by hands is very efficient. Okay, because because the number of Shigella required to cause the disease is very small. Just a few numbers of organism in the hands can actually be effective at spreading this infection. Therefore, effective hand washing is key, as simple as that. Just hand washing is key at preventing Shigella. Okay. And if not well prevented, if it causes disease, treatment is available through antibiotics. And that is the importance of having people that handle food follow these hygiene rules, because a number of conditions can be spread through the same. The other one is amoebiasis, which is the third deadliest paralytic disease in the world. Around 10% of the world's population is thought to be infected by parasitic amoeba from the genus Entamoeba genus. The most pathogenic being Entamoeba histolytica, which is the agent of amoebiasis. The large majority of infected persons often present with no symptoms, but in some cases, infections lead to clinical complications presenting with dysentery and liver abscess at the end of the day. So we said Shigella causes about 60% of dysentery presentation or dysentery diagnosis, meaning the other 40% is caused by other pathogens, which include amoeba, which also presents with dysentery. Okay, amoebiasis is caused by Entamoeba histolytica, which is an amoeba that predominantly infects humans. The main mode of transmission of this amoebiasis injection is through the cyst, okay? Through the cyst that will be found in contaminated water or food, okay? Once the cyst enters the human body, it exists. It removes the cyst, okay? It removes the cyst and produces a trophozoid that colonize the large intestine where they spread and cyst, okay? So they open up, start spreading, and while they are spreading, causing disease in this host, the others are insisting, they are putting on the cyst so that they can be spread or they can be excreted through feces again, through stool, to perpetuate the life cycle by further fecal oral spreading. So once they insist they spread, they also remain on the surface where another person could pick them and do the same thing through the fecal oral route. And the cycle continues, as well as the spread also continues. It is common in regions and countries with defective sanitation where amoeba parasites can spread easily. This neglected disease is a major public health issue in these areas, and the effective diagnosis of cysts and preventive measures of hygiene are vital in tackling this problem. Okay, so even in Zambia, we have a lot of places where you would be going around and you will see large posters where they have said no open defecation allowed. Zambia, some areas around our country used to practice open defecation. So those were actually hotspots for these conditions. These conditions were endemic to those areas. And now, since it's a public health concern, measures have been taken. Those people are helped to improve their sanitation and hygiene. They are helped by building for them toilets and other sanitary conditions so that we prevent the spread of this infection. Otherwise, if it doesn't work like that, if the government does not intervene in that way, there will be a lot of spread. Okay, there will be a lot of spread which will be uncontrolled at the end of the day, and it will be very expensive for government to actually treat those people, as well as it is causing a lot of disease on the population. So it is a public health concern and should be treated as such. Trophozoites are invasive and destroy the intestinal mucosa, causing painful bloody diarrhea, which is described as or defined as dysentery. It may cause abscess as well as abscesses. Okay, so those are what will be noticed. Epidemiology, between 10 and 20% of infected people may develop severe symptoms, and the disease is responsible for about 40,000 to 100,000 deaths each year. Okay, mainly in the poorest regions, where the hygiene conditions and lack of effective sewerage treatment plants encourage the spread of amoeba. Okay, in developed countries, the disease is rarer with sporadic cases in travelers returning from endemic countries. So I'm sure we're exposed, or we know that the sewer system, the sewer arrangements have to go to a central point, which is the sewage treatment plant, where sewage will be treated and dished back to for safe disposal. So once that is not done, the spread of these infections, all of these will continue, and they'll continue spreading in the community. So this is the more reason why we have treatment plants, and treatment is done in the sewage at these sewage facilities. Okay. Treatment for amoebiasis can be treated by taking broad spectrum and parasitic drug combined with amebicides, okay, of contact acting locally in the rumen. In areas where amoebiasis is endemic, WHO recommends treating asymptomatic carriers with contact agents to reduce the risk of transmission. The cause of such, although antiparasitic drugs currently available, are unknown to be effective, the use of such drugs in non-specific cases raises a problem of resistance. So meaning the issue of just giving for prevention or just giving unspecific to unspecific or undiagnosed people, at the end of the day, it may lead to issues of resistance. It has to be done to people who have been diagnosed and confirmed that they have the disease. That is the ideal. But in cases where you are doubting, you are not sure, you can do the broad spectrum one and control the disease. Okay. Prevention to reduce the transmission of cysts remain essential. It is based primarily on the elimination of fecal contamination of water, food, hands, as well as development of diagnostic methods. The next one is cholera, which is an acute diarrheal infection caused by ingestion of food or water contaminated with the bacterium Vibrio cholerae. Cholera remains a global threat to public health and an indicator of inequity, okay, and lack of social development. So cholera will show you, will actually indicate where the problem is. We actually indicate that the other side has been unjustly awarded with social amenities. So WHO estimates that there are nearly 3 million cases of cholera and more than 95,000 deaths from the disease each year worldwide. So these are alarming numbers. In Zambia, we just had an outbreak in 2024. Okay, as of 29th January 2024, the country reported a total of about 18,514 cases, including 643 deaths as at that time, which resulted in a very high case fatality rate of about 4%. So this shows how serious this condition can be when it has when it attacks. Okay. So cholera is extremely virulent. Okay. Cholera is extremely virulent. Disease transmitted through the ingestion of contaminated food and water, and it can cause severe acute watery disease and the severe forms of disease can kill within hours. It takes about 12 to 5 days for a person to show symptoms, and it can lead to death if untreated. Treatment is key and has to be promptly done because it has a high fatality rate within a very shortest period of time. Epidemiology, cholera can be endemic or epidemic. Endemic areas are those areas where confirmed cases of cholera are detected during the last 3 years with evidence of local transmission, meaning the cases are not imported from elsewhere. They have been developed just from within the at least past 3 years. There is evidence of local transmission. Or there could be a cholera outbreak, also known as an epidemic, which can occur in both endemic countries or endemic areas and in areas or countries where cholera does not regularly occur. We have places that have cholera cases almost every year in Zambia, like where the previous outbreak was. Almost every year, or if it skips, it's just a 2-year sequence, there will be a cholera outbreak. So those areas are the ones that are referred to as endemic. Cholera transmission is closely linked to inadequate access to clean water and sanitation. Therefore, typical at-risk areas include peri-urban slums, as well as camps for internally displaced persons. So you find that these areas that I mentioned are the ones that have higher incidences of cholera or higher endemic or epidemic rates uh, because they are characterized of poor sanitation, poor drinking water, and all those. So we have higher cases in those. Even here, we used to see people that were chased from fishing camps. In those some other fishing camps somewhere in the regions of Mumbwa, we saw where the authorities went there to actually disperse the people from there so that they contain the disease. As well as overcrowding continues, there are very poor sanitary conditions and the spread is worsened. Okay, so during in 2022, there were about 472,000 cases and 2,349 deaths were reported by WHO from 44 countries. This is not a mean number, and it just tallies with what we found in Zambia and shows that these cases are actually virulent. Okay, prevention is key, and it is done through a multifaceted approach which cholera can be controlled to reduce the number of deaths. A combination of surveillance, water sanitation, water surveillance, water sanitation and hygiene, social mobilization, treatment, and oral cholera vaccines are used to control this infection or this disease. It is easily treatable disease, and the majority of people can be treated successfully through ORIS as recommended by WHO with the instructions. Once the instructions are followed and rehydration is done using ORIS adequately, this disease can be treated. Severe dehydrated patients are at risk of developing shock with rapid administration of intravenous drugs. Is if intravenous fluids is not done in time. So meaning the first line is to do rehydration using ORS, and if not successful or if you're not done well, and if you are closer to the facilities, intravenous fluid can also be administered. Okay, so key is on rehydration at the moment, and appropriate antibiotics can also be used to diminish the infection. There are some vaccines that have been developed, and these are the three types of vaccines, okay, which require 2 doses for full protection. And there must be at least a minimum of 7 days and no more than 6 weeks delay between each dose for one to acquire at least full protection. Okay. All right, so this takes us to typhoid. Typhoid fever is a life-threatening infection caused by the bacterium Salmonella typhi. It is usually spread through contaminated food or water. Urbanization and climate change have the potential to increase the global burden of typhoid. We are experiencing climate change effects at the moment, so meaning we are at risk of having such kind of infections. Persons with typhoid fever carry the bacteria in their bloodstream and the intestinal tract. Symptoms include prolonged high fever, fatigue, headache, nausea, abdominal pain, constipation, or diarrhea. Some patients may have rash. Severe cases may lead to serious complications or even death. Okay. Improved living conditions and the introduction of antibiotics result in drastic reduction of typhoid fever. Morbidity and mortality in industrialized countries have been have been observed. Okay, so it all borders on the sanitary part. Typhoid risk is higher in populations that lack access to safe drinking water, and adequate sanitation, and children are at higher risk of getting this infection. Treatment can be treated with antibiotics, and even when symptoms go away, people may still carry typhoid bacteria, meaning they can still spread to others by shedding bacteria in feces. Therefore, it is important for people being treated with typhoid to avoid, to follow the following. Number one, to faithfully take the prescribed antibiotics and to observe hand washing, proper hand washing procedures. Okay, to also avoid preparing food for others, and this will lower the chance of passing the infection from one person to the other. This is emphasizing the reason why it is important for food handlers to have that certificate, which they have to go to the lab and do all these tests so that they cannot spread these infections. Because if one is selling food and they're infected with this, whoever will be buying that food which is ready to eat is likely to develop any of the conditions which we have talked about. Prevention. Typhoid fever is common in places with poor sanitation and lack of safe drinking water. Therefore, improving sanitation and improving the drinking water facilities prevents the development of typhoid. A single injectable dose of typhoid from 6 months, injectable dose in children from 6 months of age, and in adults up to 45 years or 65 years, depending on the vaccine, can also be used and can be very helpful. So those are the major conditions that we have talked about, but there are some other conditions that also present in the same way, and they are spread through the fecal oral route. So amongst them are paratyphoid, Giardia intestinalis, salmonellosis, ascariasis, enterobiosis, and ancyllostomiasis. So these ones, we can read on them, understand them, because they fall in the same category. All right, thank you so much for your attention. We'll meet in the next presentation.